Hello, class. For this week's discussion, I will be going over the technology that's involved with my telehealth program. The name of my program is Simplified Infusion Services for Chronic Care in Rural Communities. A little bit about the program. It is for patients with chronic immunodeficiency disorders. They will be receiving care through home infusions and telemedicine visits. The program will target 4 rural cities in Arizona, where there will be spoke site hospitals, including Flagstaff Medical Center, Yavapai Regional Medical Center West in Prescott, Florence Hospital, and Tucson Medical Center. The hub or main hospital is Honor Health John C. Lincoln Medical Center in Phoenix, Arizona. Now, initially, the patient will meet with a doctor and nurse in a rural hospital for evaluation. Any blood work and all required lab testing will be made during this visit. The information will then be transferred via electronic health records to the specialist in the hub hospital. And then a telemedicine visit via conference video call will be made. It will include the specialist, the patient, doctor, and nurse in the rural hospital. During the video call, the patient will be evaluated by the specialist with the help of the doctor and the nurse. An infusion treatment plan will be established, and the patient's questions will be answered. After this initial appointment, the nurse will be the main point of contact for the patient and will leave the patient's care. The nurse will provide the patient with a tablet and will help the patient learn how to use that tablet and the communication tool Zoom for Healthcare. The nurse will also educate the patient about sterilization techniques, how to install and remove the catheter, how to use the pump for treatment dispense. Once the patient is home, the infusion services will be monitored by the nurse through video conferencing calls based on any questions the patient may have. In addition, instead of the nurse traveling to see the patient, she can conduct follow-up visits through video conferences. The patient will be evaluated, and this will allow the nurse to request treatment prescriptions as needed and successfully ship treatments. Patient information and notes will be forwarded to the specialist in the hub, and if anything in the treatment needs to be changed, any additional follow-up is required, or any more in-depth appointments are needed, the specialist, the doctor and nurse, and the patient will again have a video conference call to reevaluate treatment. I have selected Zoom for Healthcare as my program's video conferencing tool. It will ultimately improve patient outcomes and communication. It will maximize resources and also allow better internal communication between clinicians. It can be difficult for patients or caregivers to manage infusion therapy since not everyone feels comfortable providing treatments through catheters or injections. There can be several questions associated with the step-by-step procedures and also sanitary concerns. This is when the HD video and audio Zoom for Healthcare has to offer comes into place. If a nurse is explaining a step-by-step procedure, a clear image is necessary. Now, the communication tool also offers video conferencing in low bandwidth environments, which is required since the patients are in rural locations. It is simple and easy to use with a single sign-on. The patient doesn't have to worry about multiple logins and steps. It is also has built-in instant messaging, which allows patients to communicate questions that don't require a video conferencing call, and vice versa for the nurses in case they have questions for the patient. It is also HIPAA compliant, and Zoom for Healthcare also integrates with Epic. This is beneficial for clinicians if they need to schedule video conference calls to discuss patients' plan of care. And it only transmits encrypted information. In addition, multiple members can join the video conference. This is beneficial when the nurse wants to include the specialist in one of the visits or when the patient's plan of care needs to be reevaluated. Now, there aren't any specific physical tools besides the tablet that will be used with Zoom for Healthcare. All the monitoring devices, pumps, catheters, and any other supplies will be provided to the patient based on the level of care. Zoom for Healthcare is web-based and is the foundation of communication for this telehealth program. At the end of the day, the main goal is to communicate effectively with rural patients and provide them the best infusion care without the hassle involved with traveling. In addition, nurses will cut back on traveling time and will be more resourceful when it comes to answering multiple patient questions. I look forward to learning more about the technology and the tools that you guys will be using for your telehealth programs. Thank you.